Charlie Lockhart, Sports Injuries 18.1 presentation.
So these are the extrinsic risk factors which I'm going to be talking about today. Coaching, incorrect technique, environmental technique, coaching and footwear, and safety hazards. So on to coaching. Poor coaching can lead to players practicing the wrong techniques. For example, a bowler can practice one technique by having his back in the wrong position. So a coach needs the correct qualifications and knowledge to prevent this from happening and reduce injuries in the first place. Additionally, the communication shown between the coach and the player needs to be easy and understandable so that the player knows what to do, especially practicing. So preventive measures, as I said, up-to-date knowledge, qualifications, also duty of care, so the coach will know how to take care of his athletes and how to coach the right techniques and positions. Up-to-date knowledge as well, they need to have a good coaching manner and know the level of expertise that the performer has, so that they can train them in different intensities than they would for other performers. So this will prevent injuries because the coaches will therefore have the knowledge and expertise of the athlete's level of fitness, skill, and know how hard to train them basically, and what techniques are right and what are wrong. So incorrect technique basically links to poor coaching. Many overuse injuries are shown to be doing repetitive actions, poor techniques, which can also cause excessive pressures, and an example of this is a tennis elbow, which is often caused by a bad backhand technique in tennis. So the coach needs to find a way to stop this happening, because over time the symptoms can get worse and worse, and it could lead to some time out of tennis in this case. In addition to this, a poor technique can also lead to more acute injuries. So in the gym, for example, on exercise machines, this is where a muscle or area of soft tissue can suddenly be stretched, which can happen quite a lot. Preventative measures of this, when taking up a sport or when playing a sport, it's a good idea to get training sessions and lessons with qualified coaches who know how to prevent this from happening, who have got the qualifications in the sport, in probably injuries as well. They know what injuries can happen, so injuries can be prevented and make less occurrence if they know the knowledge, especially if they've already caused an injury. They can then learn from their mistakes as well. So environmental factors can occur when athletes mainly are working in very hot or very cold conditions. So dehydration can be caused by very hot weather. I've seen an example of this in Australia recently, where Joe Root was dehydrated and he couldn't really play much. So he might not have had enough water, fluids. So this can cause headaches, clammy skin and muscle cramp, as well as lightheadedness. Additionally, hypothermia is caused by excessive cold. This is where the internal body temperature drops to below shivering. This can cause confusion, tiredness, shallow breathing, and this is where coaches and referees and umpires need to think whether the conditions are actually suitable to play or not suitable to play. So yeah, preventative measures could be not to allow the players to play in too cold or too hot conditions. In football, this will be up to the referee because they will need to call it off. It's their own judgment if it's too bad for the players, for the environment. So yeah, this also means that injuries will be reduced a lot because the environmental factors will be considered more before matches and training, especially, such as frozen pitches, and also a risk assessment beforehand will prevent this from happening. Clothing and footwear. So each sport has their own clothing and footwear. For example, in cricket, where there is protective equipment, there's footwear for batters so they don't get a yorker on their foot and break their toes or their foot. Also in athletics, they have spikes so they don't slip, more grip on the track, or even in cross country, they've got more grip on the grass. So yeah, there are the examples. And preventative measures of this could be to have the correct equipment and footwear. So if you forget your spikes or something in cricket, in a club match or something, then you have to wear trainers, and if you get a yorker, it's not nice, you could get injured, your foot, clothing as well. If you don't wear a box and you get hit in that area, then it's not very nice. And yes, also in rugby, so this comes down to protective equipment, like gum shield is very important. So if you get tackled or get a boot in the teeth, then you could lose your teeth as well. Safety hazards. So importance of safety checks, environment safety checks, is very important. Risk assessments can do this before a match, before training. Safety checklists that coaches could have. They could have also first aid kits which could prevent injuries from occurring. Well, they couldn't prevent, but could help the injuries straight away. So risk assessment is very important because this can be completed, let's say before a basketball match in the sports hall, where in a school there might be equipment left out which needs to be in the store cupboard. So the coaches would do this before the sport's taking place. So yeah, the preventative measures of this is a store cupboard, which would be important for equipment to go in. So injuries wouldn't be occurring, for example, tripping on nets or posts. So the risk assessments will come into place there. And that's it.
Okay, how important, I'm trying to look at the link between preventative measures and sports injuries.
Yeah.
Are there kind of two different strands that are important when dealing with preventative measures? Two different responsibilities?
Intrinsic and extrinsic.
No, they're the factors, but the people that deal with the preventative measures, or the way that we deal with preventative measures. Does anyone have a role with that? You've spoken about a couple, about risk assessments, and so who's responsible for risk assessments? Do they play a role?
Oh, the coaches. Yeah, coaching that sport.
Okay, so the coaches
So
are one strand, and what would be
maybe
another
referees.
strand that can,
Officials.
and apart from humans, looking at someone else, looking at some other factor? What do risk assessments look at?
Preventing injuries from happening.
Okay, alright, cool. Alright, excellent, thank you.
Oh, God, that wasn't good, was it?